Okay, so welcome. We're going to do a neuro screen for our patient here today. We're going to go through a couple different neuro screens. We're going to start with a sensory screen. So here we're going to have the same process for both the myotomal screen and the peripheral nerve screen. For the myotomal screen, I'm going to ask the patient to close their eyes and feel just a light touch like this. And I'm going to go through both, I would go through both the upper and lower extremity myotomes from C2 to L4. So I'm going to demonstrate a few myotomes here. So I'll have the patient close their eyes and let me know when you feel a light touch, okay?
Mm-hmm.
Check here.
Yep. 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 Yep.
So you can go ahead and open your eyes. So those are a few myotomal positions, or dermatomal positions, excuse me. Next I'm going to do a peripheral sensation. We're going to just focus on the upper extremity so you can see it on the video. The same procedure, but the locations are going to be slightly different as they're targeting specific peripheral nerves to look if there's a peripheral nerve issue. For the upper extremity, I'm going to have the patients place their arms open and go ahead and close your eyes and let me know if you feel anything. I'm going to touch here.
Yep. 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 Yep.
So for these, oh, sorry, we've got a visitor. So you go ahead and close your, open your eyes. So here we're testing the supraclavicular, the axillary, the lateral, interbrachial cutaneous, the radial, median, ulnar, and then the medial antebrachial and or medial brachial and medial antebrachial cutaneous. So that's the sensory component. Next, we're going to go into a motor component. For this, we're going to look at myotomes as well as motor coordination, which should indicate some motor control. So for this patient, we're going to start with myotomes. I'm just going to do a few myotomes, but for a full screen, I'd want to do both the full and upper and lower extremity myotomes. For the myotomal screen, I'm going to have the patient hold and resist for 5 seconds to look for fatigable weakness, excuse me. So I'm going to have you bring your arm up like this, right here. So I'm going to stabilize, and then you just resist me here, pushing down. Good, relax. And then on this side, same thing. Lift your arm up and resist me here. Good, and relax.
Right.
Okay, for the lower extremity, I do the same thing for each of the myotomal locations, but for the purposes of this video, we're going to skip through that. Next, I'm going to do motor control or coordination. So I'm going to have the patient bring their arms out like this, and then I'm going to have you touch one finger to one nose, and then touch the other finger to the other nose, to the same nose.
Yeah.
Good. And next I'm going to have you bring your finger in to touch your nose, then touch my finger, then touch your nose again, and you can extend your arm out. All right? Does that make sense? So bring your nose, my finger, back to the nose. Good. Other hand, my finger, nose. Good. All right. So that indicates that motor control and coordination are both intact. Next, we're going to I'm going to give you 3 words for the cognition and orientation portion of the screen, and I want you to remember those 3 words, and then I'm going to ask them later, ask you to repeat them back to me. So we're going to do lotion, crate, and computer.
Okay.
So if you can repeat those words to me real quick.
Lotion, crate, computer.
Okay, good. So I'm going to ask you them later. Next in the screen, I would perform an integumentary screen and a cardiovascular screen. This would be integumentary screen if the patient had a fall or a mechanism injury that might indicate kind of a bruising. I would check the area of the skin that might be affected to make sure that nothing happened there. And then for, I would also kind of screen for generally just check the skin, check the color, the pallor, the temperature, make sure there's no signs of infection or anything of that nature. For the cardiovascular system, I would screen by taking vital signs, looking at blood pressure, heart rate, temperature, SpO2 and oxygen levels, and that would give me an indication of the patient's cardiovascular health. Oh, well, we got a friend again. So now we're going to complete the cognition portion of the exam without this guy. Okay, so I gave you 3 words. If you could just repeat those back to me.
Lotion, crate, computer.
Very good. So that's checking short-term memory, which is intact, and then we're going to ask you a few questions to gain kind of a little bit of your orientation perspective. So do you know where you are right now?
Yeah, I'm in the hospital.
Very good. Do you know why you came to the hospital?
Yeah, I was in a lot of pain. Yep. And I
Very
got
good.
that fixed.
Very good. Perfect. And then do you know who the governor is right now?
Roy Cooper.
Very good. Okay, so today we're going to do a quick cranial nerve screen. I'm going to start with the first cranial nerve. We're going to check your sense of smell. So I'm going to hold a smell up to your nose. I want you to close one nostril and close your eyes, and then see if you can notice the smell and then identify the smell for me, and then we're going to test the other nostril. Okay, so go ahead and close your eyes. Close one nostril.
Lavender.
Yep, very good. Check the other nostril.
That's cinnamon.
Yep, very good.
Okay.
Okay, next we're going to check the second cranial nerve. We're going to check your eyesight as well as the pupillary and the consensual reflex. So I want you to look straight forward. I'm going to shine the light into your eye and just check for those reflexes. Go ahead and look forward for me. Very good. Very good. Next, we're going to check how your eye muscles are going to move and track. So I want you to keep your head facing forward and follow the tip of this pen with your eyes for me. Very good. And I'm going to bring it close. Let me know when you can start to see double of the pen.
Nope.
Right there. Good. Very good. That's all intact. Next, we're going to check the motor ability to clench your jaw right here. So I'm going to squeeze your jaw down nice and tight. I'm going to feel here for contraction and relax. Good. Next, I'm going to check the sensation in your face. I'm just going to give you a light touch, just like this. I want you to let me know if you can feel the touch and let me know where the touch is. Okay? Go ahead and close your eyes for me.
Yep. That's on the top right of my head.
Very good.
It's on my left cheek.
Good.
My right jaw. Left top of my head. Right cheekbone. Left cheek.
Very good. So all sensation is intact there as well. Next, I'm going to have you make a few faces for me. Can you give me a nice big smile? Very good. Can you blow your cheeks out? Good. A little kissy face. Very good. And then now we're going to check for hearing and balance. So I'm going to give you a light rustle in your ear. Let me know if you can hear it, and tell me if you can identify which ear it's coming from. Okay? Go ahead and close your eyes for me.
My right ear.
Good. Can you hear it now?
No. My left ear.
Good. So hearing's good in both ears. Next I'm going to have you stand up, and we're going to do a quick balance test. I want you to stand with one foot in front of the other, just like that, heel to toe. Good. We're going to hold this for 30 seconds. So we'd hold this for 30 seconds, and that would qualify for a screen for the cranial nerve, for the vestibulocochlear nerve, as well as qualify as a Romberg or sharpened Romberg test, which would also be a balance screen. For the purpose of this video, we'll cut it short of 30 seconds, but it looks like the patient's balance is intact. So you can go ahead and sit down for me. All right. Next, I'm going to ask you to open up nice and wide and give me a nice ah. Open up nice and wide. Ah. Very good. See if you can go a little lower. Ah. Very good. See if you can go higher. Very good. Beautiful voice. And then next we're going to see shrug your shoulders for me. Nice and high. Good. Relax. Can you tilt your head down and turn up? And up in this way. Sorry. Good. Now tilt your head down this way and turn up the other way. Look up. Good. Very good. And relax. And then lastly, can you stick your tongue out for me and move it side to side? Very good. All right. Good. So all cranial nerves were intact in that screen.